When assessing skin, hair, and nails, the patient will be completely disrobed. You want good lighting. Natural light's best. Fluorescent or like a skin illuminating light works well. Mallory doesn't have any history of skin disorders or diseases. There's no family history either. She doesn't spend a whole lot of time in the sun and not, tanning beds, things like that. They would be completely disrobed, covered in a sheet. You can reveal each part of the body separately. For the skin, you're going to want to look for color and uniformity of color. There will be some difference in sun-exposed areas and areas that are not exposed. Make sure you check areas that aren't seen behind the ears, the axillary, between the thighs, places that aren't typically seen. Remove shoes and socks and make sure the feet are exposed, and examine between the toes. All hidden areas definitely need to be examined. You want to look for any lesions, moles, discolorations, things like that maybe need further evaluation. While you're doing this, you'll kind of get a sense of hygiene, how clean the person is, how well they maintain their skin. You'll want to ask them about the products they use for cleansing, hydration, things like that, how often they're exposed to the sun or any other chemicals. You want to palpate the skin for moisture and dryness, texture, turgor. You can see how well she's hydrated just by pinching the skin on the hand. Mobility, whether the skin is loose or fairly intact. You'll do that. You'll assess from head to toe everything in between. You want to assess the hair. Look closely into the scalp. You can check the skin of the scalp. That's what it is. Again, you're going to notice cleanliness. The hair should be a little more oily toward the scalp, shiny and soft. Hair that's brittle or too dry could be a sign of an underlying condition. You want to look at the distribution. Are there thinning patches or balding areas, which can be common in certain conditions or in aging men. Mallory has a nice thick head of hair, good distribution, large quantity of hair, well taken care of, soft texture, not overly dry. When assessing the nails, you're going to look at pigment. It should be a shade of pink at the nail bed. You want to look at the length, the symmetry of the nails. You look for ridging, beading, pitting, or peeling, which can show that there's some underlying condition or systemic thing going on that needs to be assessed. You want to measure the base of the nail. Inspect and palpate the folds, the edges, the proximal edges, and the sides of the nails for any infection, redness, exudate, swelling that might be infection going on. Look for cysts and warts. The nail plate, you want to check for firmness and texture, thickness, uniformity, and if they're adhering to the nail bed. You want to make sure you check all fingers and toes. Looking for nail funguses. A yellow color may indicate that there are other issues also. That is about it for assessment of the skin, hair, and nails. Thank you. See, I know it's supposed to be way longer than that, but I don't care.